The United Nations Secretary General has commended the government and science and health community in South Africa for acting early in identifying the COVID-19 variant. In a statement, Antonio Guterres also expressed concern at the isolation of southern African countries after several northern countries imposed travel restrictions.
First of all, the Secretary General wants to commend the scientific community of South Africa for having acted so quickly in identifying the variant and having been so transparent about it. But he is very concerned about the fact that the people of Southern Africa are being punished in a way. And we have been saying since the beginning that unless the vaccines need to be rolled out everywhere very quickly, because otherwise you are going to get more and more mutations. And that's exactly what we're seeing now. And you can't really blame the people of Africa for the lack of vaccine access in the continent. We need to see a greater sharing of technology. We need to see more generosity and more solidarity. And we do think that it's important that governments look again at the measures and, in fact, go more towards repeated testing or put in place other measures that could limit the risk of transmission without being so dramatic, so as to allow the movement of people and economic goods.
Let's go now to our correspondent at the UN in New York, Sherwin Bryce-Pease. Sherwin, that's the UN response, but just a short while ago we had US President Joe Biden given his country's response to Omicron variant. What was said, and how would you characterize his statement, especially given the relationship that the US has had with South Africa?
Well, Biden essentially, Tsepiso, echoing what you heard from the Secretary General and other leaders in response to the Omicron virus, in that they are applauding the transparency that has been demonstrated by the South African government, the science and health community, not only in South Africa, but also in Botswana. A lot of praise for that, despite the reaction to it in terms of these travel restrictions. Let me run down in terms of the 3 points Biden sought to highlight in his address. He said that the Omicron variant is not a cause for it is a cause for concern, but not a cause for panic. And the reason for that is that the United States, in particular, is better positioned than a lot of African countries around the world in responding to this pandemic today, as opposed to a year ago. There is a vast supply of vaccines. There might not be the level of uptake that authorities are seeking, but there are enough vaccines in this country. In fact, they are pushing the fully vaccinated, essentially the 2-shot mRNA or the 1-shot J&J, to get a booster shot, because those are now freely available. He talked about the best protection is being a fully vaccinated individual, and he talked about the need, if necessary, to accelerate new vaccine development were there studies and the scientific research to show that the current variant escapes the protection being provided by current vaccines. So the overarching message from the president is that there is cause for concern, but not cause for panic. He was asked if the United States would be broadening their travel restrictions to countries where the new variant has been identified. He talked about how this would depend on the rates of transmission in those countries. He was also asked a question if the travel ban imposed on southern African countries would discourage other countries in unveiling or being transparent in terms of new variants they might or might not discover in their countries. And he said he didn't believe that to be the case, Tsepi. So we also heard earlier today from the Director General of the World Health Organization, Dr. TEDROS GHEBREYESUS. He was speaking at a special session of a World Health Assembly. This is what he had to say.
The emergence of the highly mutated Omicron variant underlines just how perilous and precarious our situation is. South Africa and Botswana should be thanked for detecting, sequencing, and reporting this variant, not penalized. Indeed, Omicron demonstrates just why the world needs a new accord on pandemics. Our current system disincentivizes countries from alerting others to threats that will inevitably land on their shores.
Sound to me.
alongside President Biden and scientists around the world, Tsepiso, in that they do not know exactly how Omicron is going to transmit. They are still examining the rates of transmission, whether there will be more severe disease, whether there is a greater risk of reinfections and more risk in evading vaccines. So still today, Tsepiso, despite the rhetoric, we don't know enough about this vaccine, despite, this variant, despite the reactions we are seeing from countries in terms of restricting travel from southern African states.
Sherwin, President Biden walking a very interesting tightrope balance there, where he emphasized the need to protect Americans first, but also saying that America has a moral responsibility to other nations in terms of donations of vaccine doses. But what I found very interesting was how he defended the decision to institute a travel ban, and we know this is very popular, especially when the UN is calling for unity and ending vaccine inequity.
Despite the United States being the country with the largest number of donations of vaccines around the world, I think that is not in dispute. The president is correctly, as you point out, Tsepiso, walking a fine line, because politics is essentially domestic. And so as much as there's a recognition that, you know, if one is not safe, the world is not safe, the president of the United States' first priority will be the safety of the American public. You have a very vociferous opposition in the Republican Party that was very critical about the president even delaying the initiation of that travel restriction on Southern Africa to today instead of imposing that restriction on Monday. This, of course, was about a technical issue, informing the airlines, informing consulates around the world. The administration of the proclamation takes a few days to implement. And even so, there was a lot of criticism, even at the 2 or 3 day delay of the Thanksgiving weekend here, just in terms of placing those restrictions. So politics is domestic. That, I think, is front and center for this president, despite a recognition that if countries remain unvaccinated around the world, variants will continue, and the variants will impact countries around the world. Let's listen to Dr. TEDROS on this point, also speaking earlier at that special session in Geneva.
We're living through a cycle of panic and neglect. Hard-won gains could vanish in an instant. Our most immediate task, therefore, is to end this pandemic. Indeed, our ability to end this pandemic is a test of our collective ability to prevent, respond effectively to future pandemics, because the same principles apply. The same principles: courageous and compassionate leadership, fidelity to science, generosity in sharing the fruits of research, and an unshakable commitment to equity and solidarity. If we cannot apply those principles now to tame COVID-19, how can we hope to prevent history repeating?
Tsepiso, Dr. TEDROS, they're talking about the fidelity to science. This is key in terms of the number of people that are resistant to vaccines. In the United States, despite an oversupply of vaccines, only 59% of the population here is fully vaccinated. I think that number is raised to around 80% in terms of one shot. But 60 million Americans have not taken the first shot. And a question was posed to President Biden earlier, and he pointed out that South Africa has an oversupply of vaccines right now. The problem? Not enough people are getting those shots into arms.
Just a final question there, Sherwin, listening to Dr. TEDROS speak about reversing the gains. Some gains one would have hoped would have been made has been that of social cohesion. We've seen a lot of racial and ethnic discrimination at the onset of COVID-19. Now with this emergence of the Omicron variant, is there that kind of a social blowback for people in Southern Africa? Are people stopping that behavior of singling out people because of the origin, and I say that in inverted commas, of a variant or of the disease itself?
Yeah, it's a tough question, Tshepiso, because, different demographics have different priorities. In the United States, for example, the number of people that are not getting vaccinated some of them tend to be from the African-American community, given the historic nature of healthcare in the United States and the targeting, certainly, of black populations historically. There is an evangelical resistance in many parts of the United States to getting the vaccines, and I think this is echoed in places like South Africa. Just listen to the ACDP leader in terms of his resistance to any talk of vaccine mandates. Here's a number for you, Tshepiso. On average, around 1,000 Americans are dying every day. Every day in the United States, 1,000 Americans are dying. The vast majority are unvaccinated. Now, what is the solution to that? I'll leave that to the viewers.
All right, thanks for that, Sherwin Bryce-Pease, correspondent at the UN and in the US. He's speaking to us from New York.